Patient Sembrano.
Yes, ma'am.
Hi, ma'am. Good morning. My name is Nikila Reyes and I'm going to be your tech for today. Ma'am, pa-confirm ko, can I have your full name?
I am Zyril Marie R. Sembrano po, ma'am.
Okay. So, yes, Miss Sembrano, ano pong preference language natin para mas madali, hindi kayo may harapan po?
Pwede man kahit Tagalog, Bisaya, or English po.
Okay, ma'am. So, ma'am, i-verify ko lang, ma'am, ha? Kung sa middle name po ninyo?
Reyes, ma'am.
Okay. Ang birthday po?
March 8, 2000 po.
Okay. And ilang taon na po si Miss Sembrano?
21, ma'am.
Okay. So, ma'am, kailan yung last menstruation niyo po?
Mga last 3 to 4 days manata, ma'am.
Okay, ma'am. Meron po ba kayong mga past na experience na na-x-ray po kayo within this year?
Wala, ma'am. Mga
Okay.
last 2 years manata.
Okay. Sige po, ma'am. Thank you, ma'am, sa information nyo. So, ngayon po, lahat na verify ko na. Ma'am, pwede kong makuha yung request ni Doc po?
Ay, kani ba to siya, ma'am?
Kana, ma'am. Sige. So, yes, ma'am. Unsa di ay ang nahitabo, ma'am? Ano
Ay.
po nangyari?
Nahulog kasi ako sa hagdan, ma'am.
Opo.
Tapos, mga 5 kwan yun, ma'am.
Okay, ma'am.
Pero okay man siya, nagasakit-sakit lang siya, ma'am.
Sige, ma'am. Sige lang. Don't worry, ma'am. Na naman diri sa request ni Doc ang procedure na buhaton nato karon. So, ma'am, karon pwede na ka mag-illicit patient gown dito sa side, and then pa-remove na lang ko sa mga metallic objects sa imuhang body karon, ma'am, ha? Pwede na ka mag-ilis, ma'am. Balik lang diri, ma'am, ha?
Sige, thank you.
Thank you. Okay, ma'am. So, humana ka, ma'am?
Yes, ma'am. Human ako, ma'am.
Okay, sige, ma'am. Lingkod diha. Tapos pwede na ka maghigda, ma'am. Okay, sige, ma'am. Okay. So, right now, we will be conducting an AP projection for pelvis procedure. So, we will be using 14 by 17 for the cassette. We will be using 40 inches for the SID. And for this projection, or for this examination, we will be using grit because the body that will be radiographed is thick. So I will now go ahead and position the patient. Okay, so for the patient position, patient will be in a supine position, and the arms beside the body. Make sure to provide patient a pillow for its comfort. So, ma'am, okay, butang lang ato ang hands sa side sa imong body. Always ask the patient, ask patient's permission before touching the patient. So, ma'am, magunit ko, ma'am, ha? Okay lang. So, ma'am, okay, gana. So, for this examination, provide thyroid shielding as well as gonadal shielding. But just make sure it won't obscure any anatomical part that is being radiographed. So, ma'am, magbutang kong shielding, ma'am, ha? Okay, this is for your safety, ma'am. So, right now, the patient is in a correct position. We have to make sure that the mid-sagittal plane of the patient should be centered to the table, as well as the CR, which is already placed on the backy, assuming that I have already placed it on the backy tray. So, also, we have to make sure that the pelvis is not rotated, and the distance of the axis from the tabletop should be equal. So, always make sure for this position or procedure, we have to make sure that the leg of the patient is rotated internally for 15 to 20 degrees. So, ma'am, mag-adjust na gamay, ma'am. Okay lang, ma'am. Magulit ko, ma'am, ha? Okay. So, adjust gamay dito tapit, ma'am. Move. Okay ka na, ma'am. So, again, the patient's position or the part position should be rotated, or the leg should be rotated 15 to 20 degree internally. So, ma'am, okay lang i-rotate imong leg or ianding imong legs. Okay, kana ma'am. So right now, the patient is already in a correct position. For the central ray should be perpendicular to the IR, and it should be directed midway between the level of the axis and symphysis pubis. Make sure to center the cassette to the CR. Again, the minimum SID will be 40. So again, the central ray should be midway between the axis and the symphysis of pubis. So this is the axis. So it's on the midway. So ma'am, mag-touch ko ma'am ha. Okay lang. Okay. So right now the patient is already in a correct position. I will go ahead now and collimate the anatomy of interest. Okay, so this is a closer view for the part or the anatomical part should be positioned with. So right now the patient is in a correct position. I will now collimate it. So again, for the central ray, it should be directed midway between the level of the axis and the symphysis pubis. So, ma'am, mag-collimate ko ma'am ha. Okay. So, don't forget to put the marker and just make sure that it will not obscure any anatomy of interest. So assuming that I have already collimated the anatomical part of interest correctly, since I cannot adjust the collimation for this procedure. Okay. So, instruct patient to avoid an unnecessary movement. So, ma'am, I lihok ma'am ha, kay mag-shoot na ko. Please hold your breath as well. So, ma'am, mag-shoot na ko. 1, 2, 3. Shoot. Okay, so ma'am, human natong procedure, ma'am. Pwede na ka mag-ilis og patient gown, ma'am. And balik lang diri, ma'am, for instruction. Ay, ma'am, human ako, ma'am. So, yes, ma'am, human na. Kag-ilis, ma'am, no. Actually, human na to sa procedure, ma'am. Balik lang diri after 2 to 3 hours for result. So, pwede na ka mo ulit, ma'am. Salamat, ma'am.
Sige ma'am, thank you.
Thank you.
Anatomy demonstrated for a P projection of the pelvis. Pelvic girdle, L5, sacrum, coccyx, femoral heads, neck, and greater trochanters should be visible. Lesser trochanters should not be visible at all. For many patients, only tips are visible. So, greater trochanter should appear equal in size and shape. No rotation is evidenced by symmetric appearance of the iliac alae or wings, the ischial spine, the two obturator foramina. So, foreshortened or closed obturator foramen indicates rotation in the direction. So, a closed or narrowed right obturator foramen compared with the left indicates rotation toward the right. The right and left ischial spine, if visible, should appear equal in size. So, correct centering evidence by demonstration of entire pelvis and superior femora without foreshortening in collimated field. So, collimate the area of interest as well as the four sides of or the sides of the anatomy that is being radiographed.